and welcome to the Checkable Health Podcast. I'm your host, Patty Post, founder and CEO of Checkable, where we are making it easy to diagnose your symptoms from home using rapid lateral flow diagnostics and screening tests and pairing them with our mobile application that connects you with telemedicine. Today, I have two guests. I have two physician guests. They are a tag team couple. Doctors, Doctors Hindmarsh, Tim and May. Yes. Hindmarsh.
Tim and May works.
Wow, I looked at all of the numbers. I'm like, wait, the most important thing of this is the BS Free MD podcast and live stream that you two have. So we're going to have some fun today talking about healthcare. So welcome to the show. Tell me about both of you.
Well, I'll try to keep it short, sweet, and wrap it up. Tim and I we met in med school. We both were born, raised, and trained in Canada. And we got married 4 days after we graduated. Then did our residency up in Canada. Moved to the U.S. back in 94. And we are both board-certified family practice physicians who've had a fun career over the last almost 30 years. We did everything from, Tim did a full OB practice. I pulled the plug on that because I like to sleep. But I did lots of gynae care. And we did office medicine. We did our own inpatient hospital coverage, wow. ICU. We were coroners. As I said, Tim did OB practice. And everything back in the day when family practice docs did it all in we did rural practice. And then things have morphed and changed over the years. And then in 2010, I switched into urgent care, and Tim switched over completely in 2013 into urgent care. So that's kind of where we're at now. I am on the way out of into retirement world or rewirement world, so to speak. Currently, Tim's still doing urgent care now. We've raised our kids, so we've had lots of experience as parents as well, dealing with a lot of the things we're going to talk about. And I remember, our kids are adults now, but I remember going through, we brought our daughter home, and we had been practicing 7 years when she was born, and we looked at each other. We got home from the hospital that day. She's in her car seat, and we sat her down on the love seat in there, and we looked at each other, and we just sat there and go, well, what do we do with her? Do we just sit here? Don't wake her up. We don't know what we're doing, and we're both doctors, right? And so I guess all of this to say that I always tell patients and friends that don't feel discouraged if you have a newborn or a kid, and every phase you're just like, I don't know what I'm doing. This seems so overwhelming, because healthcare workers, I won't say struggle, but we just feel all those things as well. And people have been surviving and making it through from the beginning of time with kids, and kids are really resilient. So we share the struggles, but there's lots of tips and tricks we can share with you to make it easier.
Oh, that's great. I love that. What state are you in?
Right now we're in Oregon.
Oregon.
For 3 more weeks.
Beautiful. And then where's your practice?
It's
in Oregon?
It's literally 3 blocks from here.
Yeah.
Okay.
Yeah. And then I accepted a job on the Gulf Coast of Florida. So we're going to move there. And
fun.
We're moving from the country doctor world to the country club world, I guess you could say. It's kind of that time of life. So I'm like, I want to walk to the bar every night.
We'll give it a try.
Yeah.
So.
Yeah. Why not? Sounds nice.
Yeah.
And so let's talk about what you were saying there, May, of some things that you can do at home to manage your care. What do you recommend for parents to even have in their medicine cabinet, the self-care?
I love this topic because, man, I love to stock my medicine cabinet with all the stuff and be the nurse.
You're
I guess
a planner.
More than Tim. Yeah. And we did a podcast on when we travel, what I take with me even now, just for first aid. And Tim just kind of laughs because I get to carry all this stuff. But I got my little list here of things. Well, so First off, I guess I was thinking in timeline of kids' age, but to begin with, when you got the really littles and newborns, you always want to have like the bulb suction, and you can use that even throughout various ages, but it's great to suck out their noses when they get all plugged up. As kids get older, sometimes they'll get a foreign body in their nose or even in their ear. You can try to use that for. So bulb suction's a great thing. Obviously, a thermometer. You want to have a good rectal thermometer for infants, but there's all kinds of great digital thermometers that as the kids get older, you always need a thermometer at home, and even for adults. So thermometers a must-have as well. There's so many different kinds. The pharmacies sell great ones. I got mine from Costco. The rectal thermometers for infants, you can also use them under the armpit in kids too. So there's crossover there.
But not at the same time.
But not at the same time. Yeah.
Yeah, not at the same time.
No,
Good.
that wouldn't be
Good
good.
call.
And on that note, I always suggest having alcohol at home. You can get the little packets or a big bottle and just use cotton balls because you want to sterilize that thermometer, obviously, afterwards. But for other tools that you're going to be using, alcohol is a great thing. So tweezers, for instance, are some tools that you want to have all the time for getting slivers out, and a nice set of tweezers, as well as fine, sharp scissors for cutting those Band-Aids and bandages. Sterilize that with the alcohol. Saline, a little bottle of nasal saline is great to have for infants and all the way up to for unplugging stuffy noses. It's amazing how many times we just think about, where's some saline? And so you can flush out some wounds with it. You can unplug noses. So saline's a great thing to have. Humidifier, that's sometimes a big purchase and can cost a little bit more, and you don't stick it in the medicine cabinet, obviously. But usually it seems at some point in the first 12 months, kids will get some croupy thing or get really congested, and it can be nice to have. Then I would say, obviously, you're going to have your fever reducers like acetaminophen or the ibuprofen, and it's going to vary whether it's the pediatric or the infant chewables, but you want to have that. You always want to have some at home of those for sure, because kids seem to get fevers and sick in the middle of the night. You don't want to be running to Walgreens at 2 a.m. It's even open. So always have that on hand. And I would also say that were we going to argue about this point about the oxygen monitor, whether or not people should have it? O2 monitors, really got pushed, especially with COVID happening, how it's really inexpensive, easy to use on young kids and adults, because just put it on your finger. They are less than $20 on Amazon. In little infants, it's hard even for healthcare professionals to get a good reading.
Yeah, but it can be confusing. Like yes. I literally would do telehealth, and I would watch people do their monitor. And, their hands are freezing cold. They're 85 years old. They're shaking. And you're just like, okay, just come in.
Right.
So.
Right.
So
it's not always going to be, it's sometimes user error and it's tough to do in little kids. But if you get a good reading and it is.
It's great for adults. It's great for kids with asthma that are a little bit older. I mean, that can be a major differentiator on whether a kid needs to be seen, whether they can have a telehealth visit, whether you can counsel them on the phone. So I think there's lots of utility there. They're super cheap now. I mean,
right.
The Apple Watch has an O2 sat monitor on it now. So
okay, so we're agreeing.
There's a little. I cannot stress the thermometer enough, though, because so many. I'm like, do they have a fever? And
it's amazing how many people don't have thermometers at home.
They don't have, and
they're like, well, they feel kind of hot.
They did a study on maternal hands touching children, and they were almost perfect in diagnosing fever.
Yeah. So if they feel
really,
yes. So that actually means
you can tell
something.
that they're burning.
Yeah.
The other thing I'll throw in there right now, because it is my biggest pet peeve in almost all of medicine, which says that I don't have very many pet peeves, is a fever is an actual objective number. It's 100.4 degrees Fahrenheit. So
okay.
So people come in.
99 is in the fever.
99 is not a fever. It may not be normal, but it's not a fever. So people go, well, I run 96. So when I'm 98.6, I have a fever. No, you're checking your temperature too often because how do you know it's 96? That's kind of odd. So, so in reality, you don't get your own fever. It's a 100.4. Water boils at 212. These are hard, fast rules. So that's really important. And it's going to be more important when we talk about childhood illnesses because fever is a really big deal in children under 3 months, and it's usually not a big deal in children over 3 months, or often it's not. Most often it's not. So those are
Good point.
having hard data we love as physicians because it really helps us guide people and potentially keeps you home, which is kind of the goal of a lot of this.
Yeah. So we will get back to that, but I want to get through my own list of suggestions first.
Your list is awesome.
So the other thing you want to have is a syringe. You can get one from your pediatrician's office. They're easy to buy, but there's nothing worse than trying to give medicine to a child. You don't have a syringe and a little infant. You can measure it up exactly when it says on the bottle to give them 2.5 mLs, and you're trying to measure it in a little cup, and they don't want to take it from that, and they spit it all over.
So you want a 10 ml
Yes.
specifically.
Yeah, a 10 ml syringe is perfect, and those can be washed, sterilized, cleaned.
Squirt it in their mouth like a cat
There you go.
Yeah.
and hope for the best.
Yeah. Hopefully they swallow it.
Yeah.
Exactly. I obviously like to have things like all the Band-Aids. You can get these, pick your place to purchase a little pack of various size of Band-Aids, from tiny little spots to the bigger ones. And butterfly dressings are great. And people will come in oftentimes when someone has a tiny little cut and they think it needs stitches, and they've already put the butterfly strip on there. I'm like, you've done it perfectly. You brought the skin edges together. I'm not taking that off. I don't need to put stitches in this tiny little thing. And they're amazed. And they work, butterfly strips work wonderfully. So that's an easy thing to have, like I said. And check those kits every now and then. I was surprised. I had one that was in the medicine cabinet for so long. The bandages started to get all curled up, and then it didn't stick. So they do expire after some time. And then I would say I like to keep hydrocortisone cream, 1%, because you use that for so many things. And it's pretty safe to use on most parts of the body, from all ages. In little infants, you want to just be careful and ask your pediatrician, but you can use it for any kind of itchy areas, eczema to insect bites that are itchy, dry skin rashes. You want to just be careful of the amount that you put on, but it's something that I think everyone should have at home and is really useful. As well as, I love Benadryl cream for itches too. When kids have those little sunburn or they have an insect bite, the Benadryl cream works wonderfully, and adults can use it, as well as the oral Benadryl for any kind of allergic reactions that they might be having, or hay fever season. Then I would say rehydration solution, such as Pedialyte, just to have at least one on hand for those middle of the night emergencies, because kids always will get gastroenteritis at some point, and that vomiting in the middle of the night, like I said, you want to be prepared. And if you're using it, you can run to the store for more. It's not like you need a case, but
remember when our house was entirely demolished. We were remodeling our house and making our kind of forever, house. And May was pregnant with our son, like really pregnant. And our daughter was about 15 months old, and she got gastroenteritis.
She got the norovirus.
And
oh wow!
And we had no plumbing.
We had no running water, and we had an outhouse.
So we had like the workers, porta potty outside, and she didn't need extra diapers. She needed a onesie that was an entire zip-up diaper.
Yeah.
Because she was.
Oh my
so it was coming.
gosh.
When they get
so May's out there with like it goes up to their neck, which is kind of standard operating procedure for kids.
So lots of baby wipes, and and then I was running to the friend's house the next day to do laundry and give my kid a bath. Yeah, that's what it was.
Yeah.
I mean, I think every parent who's had a young one that goes through a rotavirus experience, and so you want to be able to give them some oral rehydration replacement. And that's a great thing to have on hand. But yeah, wipes are always in the house, right? When you got kids. I mean, yeah, that was a nightmare. Ice pack.
Yes.
Everybody's got boo-boos and owies, but it's easy to make your homemade ice pack. And I did not realize how easy it was until I had my own surgery and I learned this trick. And now we keep one in the house, a couple of them, different sizes. All you have to do is get corn syrup, the white kind, and you get 1 or 2 bottles, depending on how big you want to make your ice packs. You pour them in a Ziploc bag. I double bag it. I pour it in one bag, then I flip it upside down, put it in another bag. So if it does leak, it's protected. You freeze it. It never goes rock hard. It always it's moldable, and you can reuse those things for years. So I have like a little small one, and then I have the big gallon size, and you just keep them in your freezer. And anytime someone gets an owie, you can pop that ice pack on and introduce.
We have to have at least 2 of those that are over a decade old from all of our knee surgeries. Yeah. And they, unless you drop it and it ruptures, they don't go bad. The key is to have the inner and outer bladder, because otherwise you have sugar everywhere.
You'll find the hard way when one explodes in your freezer and you're trying to clean that stuff out.
Be nice and sticky.
Yes.
Ugh. Yeah.
So that's another little.
I mean, what does it cost for the Caro syrup? It's like nothing. $3 or something.
It's like $3.
Yeah, $3 to $5 depending. I was asking some of my friends again about what they like to have at home in their medicine chest, and some of them are like, barf bags. Carry them around. And you know what though? The easiest for me, what I like the most, is just using Ziploc bags. Our son would get car sick all the time, and I would carry Ziploc bags in my glove compartment, and then most people have them at home because you can seal them off instantly, and you don't have to worry about them spilling, and the odor won't come out. So I always tell people, just use Ziploc bags. They're easy to have. Just don't use them up. So
and car sickness is a real thing, especially now. Kids are always watching something when you're driving, which is probably awesome because they're distracted. Yeah. But they also makes them. Our son would just throw up into the map pocket behind my seat.
Yes. Oh my gosh.
Yeah. And now he's a pilot. So tell me how that makes sense. He does not get airsick at all. He pulled. Really? What did he pull? He pulled 9 Gs in an F-16. Nothing. No nausea. Nothing.
I think he's gotten it all out of his system.
Yeah, because he filled my map pocket up in my pickup truck. Like God knows how many times.
Anyway, the beautiful part about the Ziploc is, yes, you can seal it so the smell is gone. And
if you buy the for sure, like the barf bags, if you buy them, you can seal them too. But I mean, you don't need to spend.
Scared. Twist. I don't trust it. Anyway, that's just. Let's see. I think I got most of my things. So the next couple things that are really specific. So an EpiPen, obviously, that's going to be for kids who have got known allergies, been diagnosed, or found out the hard way. But if your child or anyone in your family obviously has true anaphylactic allergies, do not be without an EpiPen. And so I bring that up just because some people go, yeah, we should have one, but we haven't kept up on it. We've seen some horrible crises because of it. So they do expire. It is important. Those ones, you shouldn't fudge around. If it's expired, it's an issue. So EpiPen's important if you have a kid that has anaphylaxis. And then this is a cool new device. I never had this, but a girlfriend does, and I think it's ingenious and people should have it. It's called LifeVac. And I don't know if you've heard of it, but it is basically, then there's a couple different ones available, and they're running from $55 to $75 when I look them up on like Etsy to Amazon is a common place to get them. But basically what it is to help in case it is a device that extracts a foreign body if someone's choking, and they make it so that it fits over a pediatric face, and then they have another shield that you can interchange with it so it fits adults, older kids, and then adults. And it's super easy to use. They have the instructions as well as a video that comes with it, but anyone can do it. You just place it over their nose and mouth, you push down like a plunger, and you pull up, and it sucks out the foreign body. And that can be the difference between life and death before an ambulance arrives in a case of a choking infant or child. So my girlfriend, she's got grandkids. She's like, this is amazing. And I'm like, I think
Yes.
everyone should have one of those, as well as probably know how to do CPR, have a CPR class if you, everyone should, but if you have kids, for sure.
I don't know how you can graduate high school or get a driver's license without knowing CPR. It's so simple now.
Yeah.
There's no rescue breathing. That's all gone. It's just chest compressions until you get a second rescuer. It's chest compressions and being able to put the pads of an AED on somebody. It just gets better and better. It's very evident. It's one of the one places in medicine where it's incredibly evidence-based. So they're like, what works, what doesn't work. It has evolved massively since CPR started about 50, 60 years ago. So pretty easy to do. Again, I would be an advocate for, this is part of high school. You get you do your basic science stuff in high school. You learn a little bit of history, and you get a finance class and a CPR class.
Everyone should be trained.
So I don't know if you have kids, Patty, but that's if I've missed anything that you like to have, well, let us know. But I think there's so many more. As healthcare providers, we have access to a few more things, and I know like doctors and nurses and other providers will have other kind of things we can use, like a beveled needle, because it does make it easier to get out. Slivers, sometimes just the tweezers and stuff, but
Portable cautery is awesome for taking, like, for subungual hematomas. You're out hiking and you blast your toe into a rock and get the blood under your toenail, under your fingernail, and it hurts like crazy. These portable cauteries are just red hot. You just touch it to the nail, boom, drain it, you're good to go. Yeah. Most people can't do it on themselves. What I have done is we have to throw them out when we use them because it's technically sterile. Well, it's not like it gets contaminated. The only tip that touches the patient is red hot. So what I used to do is I would drain these for the patient and I would just give it to them. Because it's going to work another 50 or 100 times. And I'm like, dude, you're out hunting and you trip and fall and you get a hematoma under your finger or toenail or whatever.
If they run out of matches, they can light a fire with.
Well, you couldn't light much of a fire with that.
Anyway.
You can drill holes in fingernails like crazy.
But it is nice to have like an 18 gauge or larger needle that has a beveled edge, because it does make it easier to take slivers out and things like that. But, my mom didn't. She had the old-fashioned, very large darning needle. She would clean it off with alcohol and use that and some tweezers. You just have to be careful. But
later,
most moms don't want to run into the doctor for little slivers.
She'd get the darning needle and a De Maurier light and take out your sliver.
There you go.
I love it. That very authentic.
Yeah.
Yes.
That's the 70s for you.